Yes, so we are going to talk about postnatal assessment in today's class. So the last assessment that you are likely to get in your OSCE is postnatal assessment. In the UK, postnatal assessment is done on day 3. Often at times it's done in patient's house. So it's likely that in your examination they will say that perform a day 3 postnatal assessment in patient Helen's house, or it could be in the hospital. What is the first thing you need to do when you are doing your assessment? 6 points of checks. I have always been talking about this and I'll keep preaching about it. Do your first 6 points of checks. After you have done your first 6 points of checks, what will you do? Score pain. Helen, are you in pain? What is your pain score ranging from 0 to 3? Because this is per the Meow-Schacht standard and the midwifery standard. After you have scored the pain, what will you do? Review history. Read out the history and ask, Helen, are these history correct? Is there any additional information you would like to add which was not demonstrated or which was not verbalized? After that, you now explain your procedure to the patient, that you are here to be doing your assessment and you'll be doing it in a physical assessment. So you'll be doing a physical assessment, then you do a social assessment and a psychological assessment. So under the physical assessment, what are the things you'll be checking? Maternal observation. 6 things in maternal observation: blood pressure, temperature, pulse, respiration, oxygen saturation, and capillary refill. 6. After that, you now come and move up, down. So we start from the boobies, the breast. You cannot touch, you are not supposed to touch a postpartum woman's breast. It's tender. She's lactating. Do not touch in the exam. You are only going to visualize. You're going to inspect. So you expose one breast at a time. Visualize. Is there any crack sores, crack nipples or nipple sores? Is there any engorgement or swelling or tenderness around the breast? You cover and you examine the other side. Ask mother, what is she breastfeeding or bottle feeding? Based on those options, then you move on to the abdomen. What will you be checking on the abdomen? You have to expose the tummy, have a feel of the tummy, and check for involution of the uterus. We do not measure if it's involuted, it is involuted. If it's not palpable, it's not palpable. It could be palpable, but well involuted. So we do not measure that as well. Then you palpate for any abdominal pain and any distension. Then you move to the perineum. What will you be checking on the perineum? 5 things: color, smell, and volume of the lochia. Also ask, has mother had any tear? If yes, does it feel too painful? Is the pain aggravating? And does it feel infected or does it look infected? You also have to inspect to visualize to confirm that yes, indeed, down below is infected. Then under the physical assessment, you do what we call the VTE assessment, venous thromboembolism assessment, and we are using it to look for a condition called deep vein thrombosis, which is also called DVT. So the venous thromboembolism assessment, you are thinking about now the woman has delivered, postpartum woman is bleeding. And if you know VT, you know that VT is when a clot goes into the bloodstream. It causes cramps, especially around the calf area. So we are going to check all the possible things that can put a mother in a higher risk of developing DVT. So the first one is you need to palpate the calf, so you flex the legs one after the other. Don't do it together because you are not comparing. You flex it one after the other, you run your hand at the back of the calf. So if this is the calf, you run your hand at the back of the calf. Helen, do you feel pain as I run my hand at the back of the calf? Then you're also observing for any swelling and you're checking for redness as well. After you have done that, you also ask, Helen, do you know your BMI? Someone will say, am I supposed to know that? Yes. So over here, you are supposed to ask about BMI. If she knows, she will know, because if your BMI is raised in your pregnancy, you will have taken certain things like a blood thinner, or some people naturally take blood thinners based on their underlying medical condition. So ask, Helen, do you know your BMI? Also, did you take any blood thinners in pregnancy, such as soluble aspirin or any after delivery? Then you want to ask, are you able to mobilize? Because all these things put a woman at risk of developing. So you want of developing VT. So you want to know that mother is doing well. Then after that, you now ask if mother was discharged with any medication. Were you discharged with any medication? Okay. Are you able to take them religiously, and what are they? Then you ask, are you able to have you started your Kegel exercises yet? You ask about Kegel exercises. Then you are done with your physical checks. After which you move on to social checks. You want to know if mother has gotten a physical support, family support, either from relative or partner. And also you want to know, is she employed, self-employed, or if she's unemployed, and is she on leave that comes with pay or without pay, and has she got any additional savings to support herself and the baby. Very quick. Then you move to psychological. Under the psychological, you are checking for things that could affect mom in the postpartum phase. So you're asking, does she feel safe? Does she feel often depressed or anxious? Is she able to perform activities of daily living? Does she constantly get overwhelmed or underwhelmed when caring for baby? Does she feel constant fatigue? And does she feel constant loss of appetite? These questions will let you know if mother is struggling psychologically or not. When you are done, quickly fill your meal chart. Now I can confirm that everybody knows how to fill the meal chart. If not, I have tagged it along with this. You can come out and watch how to fill the meal chart and continue with the class. After that, we need to hand over. Please, when handing over, what are the things you are going to hand over? Total meals. Verbalize the total meals. Examiner, my total meals is 2 amber, 2 red. Maybe. Then area of concern. What is the area of concern? Maybe examiner, my area of concern is my patient has perineal wound that looks infected. Maybe she's having cracked nipples. So differential diagnosis. I can be thinking of perineal wound infection. But if her temperature is 38 and above, straight up, sepsis. I'm querying sepsis. You can also talk about engorgement or nipple sores if she's having any concern. Other area, then your recommendation. So your recommendation is going to follow straightly the back of the meal chart. What is happening at the back of the meal chart? Then you verbalize based on, if you have 2 amber, 2 red, you know you are picking the third one. So the video of the meal chart also shows how to perform a very good meal chart. So please do follow that one. And yeah, so the postnatal check is the simplest and the easiest you can ever get in the exam. And these are all that you check. Again, I will tag a demonstration of how to do a good postnatal check within the required time. Then we know that we are doing a right thing. I hope today's class will be helpful. If you have any questions, please do jot them down. During our face-to-face practicals or our face-to-face demonstration, we can always do it. I hope the class has been super helpful. Thank you, and please enjoy the rest of your day. Bye.